Welcome to Conversations with B'nai B'rith. I'm your host, CEO Dan Mariaschin. We appreciate your spending some time with us today. Today, I'm speaking with Jamie Margolis, Senior Vice President of Donor Services for Be The Match, a Minneapolis-based organization that operates the largest and most diverse bone marrow registry in the world. We'll talk about saving lives, one bone marrow transplant at a time, and how the coronavirus pandemic has impacted the organization's mission. Every 3 minutes, someone is diagnosed with blood cancer. And for patients with diseases like leukemia, a potential cure exists through a blood stem cell transplant. A blood stem cell transplant requires a perfect match from a donor who likely shares a similar ethnic background to the patient. Unfortunately, only 30% of patients find a match in their families. The remaining 70% turn to Be The Match. 15-month-old Zoe Smith is one of those special patients who needs Be The Match. Zoe is of Ashkenazi Jewish descent and is most likely to find a matching blood stem cell donor from someone of a similar genetic and ethnic background. And for that reason, her family hopes to reach a broader Jewish community to possibly save her life. In our conversation, Jamie and I will talk about Zoe's powerful story, unique matching issues for Ashkenazi and Sephardic Jews, innovations in marrow matching, the impact of COVID-19 on the matching process, and more. Welcome, Jamie. It's good to have you with us today.
Thank you so much, Dan. Very happy to be here.
Well, before we jump into the questions, a question for you about your own personal involvement and how you came to Be The Match.
Yeah, so I have been at Be The Match for just over 11 years, and I came to Be The Match. I was a postdoc at the University of Minnesota studying genetic diseases and decided that I needed to be closer to the patient. I was doing early research studies on genetic disorders at the University of Minnesota and really wanted to get closer to the patient journey. And so found my way to Be The Match. And it has been a wonderful journey of 11 years there, really taking what I had learned through genetics and through my background at the University of Minnesota and matching that with the operational delivery and capabilities at Be The Match to really serve patients. And when you think about patients, it's not just that patient that we have the ability to influence, it's the entire circle around that patient, their families, their friends, their full community. We have the ability to truly save an individual's life, and it's impacting that entire sphere around that patient. So our mission is to save lives through cellular therapy. There is no better mission to wake up for in the morning every single day.
Well, let's get to the details. How many people are waiting for life-saving matches at any given time, and how likely is someone working with Be The Match to receive or find a matching blood stem cell donor?
Absolutely. So on any given year, there are about 12,000 patients that are looking for a match. So as you opened, Dan, you mentioned that 30% of patients have somebody within their family that can serve as a match for bone marrow transplant, which is a potential curative therapy for patients with leukemia and other blood disorders. The other 70%, as you mentioned, turn to Be The Match. So 70% of the patients who are searching for a transplant match for leukemia and a variety of other blood disorders are coming to Be The Match. It's a total of 12,000 patients per year. Be The Match is different. The registry of Be The Match is different than what you're accustomed to for solid organs. So when you think about a list for liver or for heart, there's a list, and it's a prioritized list that donors are sitting on. Be The Match is different. Be The Match serves as a registry for physicians that are looking for a match for that 70% of patients that need an unrelated donor. So it's all about the genetics in terms of who's looking for a match at any given time. Somebody with a very common genetic background, it's very quick. They're not waiting. They're not waiting for that donor to show up. That physician will do the search on our registry, find that match, and move forward as quickly as possible for that particular patient. Those with more complex genetic backgrounds, finding that sometimes needle in a haystack, perfect match, as you mentioned, takes a lot more time. So be the match in terms of donation of bone marrow to an individual who is waiting is different than what we're accustomed to for solid organ, but it's that 12,000 patients per year that are looking for that match.
How long has marrow matching been going on, and how has the technology changed over time?
Yeah, so Be the Match has been in existence for well over 30 years. Stem cell transplantation has been going on for well over 30 years. The technology has continued to evolve, both on the donor side and on the patient side, of how we collect the bone marrow, as well as the treatment of the patient. So, from a treatment perspective on the patient side of things, the bone marrow transplantation has evolved in terms of how patients are conditioned prior to receiving the stem cells, so that their body is ready to receive those stem cells and produce the greatest outcome possible for that patient. A lot of work has been done over the last 30 plus years to evolve what things look like in terms of both the lead up to the transplant as well as post transplant care to provide the best outcome for that patient. On the donor side of things, things have evolved in terms of how we actually procure the stem cells from an individual donor. So many people are aware that for bone marrow, it is truly the marrow that is inside of a bone. And so we go into the iliac crust and pull out that bone marrow. That is something that we continue to do to this day, but at much lower volume. So when Be the Match first started, bone marrow was the only way to get stem cells for patients who are waiting, is to go have a surgical procedure to remove bone marrow from the iliac crust and provide those stem cells then to the patient who is waiting. That accounts for less than 20% of the collections that we do today. The vast majority of our collections are done through peripheral blood apheresis. And what that is we take the donor and we provide just a simple injection for 5 days to push the stem cells out into the peripheral blood. And then we collect the stem cells through peripheral access. So very similar to how platelets are donated. You have a needle in both arms. We remove the blood. We take what we need from a stem cell perspective and put everything else right back in there. So it's not a surgical procedure. So that technology has changed greatly.
Well, Be the Match is for everyone, but tell us about the unique issues for matches for people in the Jewish community, whether Ashkenazi Jews or Sephardic Jews. What are those particular issues that affect that part of our community, those parts of our community, and how does that impact the pool and the numbers that you have out there of possible donors?
Absolutely. So you mentioned at the beginning the need for that perfect match for a patient. The better the match for the patient, the better the outcomes. The match is the complex part. So matching for bone marrow transplantation is a lot more complex than when we think about blood transplant or blood infusions, right? When we just think about typical blood collection and utilizing those for therapeutic use, the complexities from a genetic standpoint are far more complicated for bone marrow transplantation. We match on a lot more genetic criteria to ensure that we are matching a donor appropriately with a patient. And the reason for that is purely from an outcomes perspective. The better that match, the better the outcome is for that patient. And so when we think about the unique genetics of the Jewish population, that's where it becomes critical that we have as many people representing each unique population on our registry. So when we think about the Jewish population and the ancestry and the genetics that are specific to the Jewish population, it is critical that we have that representation on our registry for when those patients do show up and need that specific genetic background. So, from an ancestry perspective, that Eastern European genetic ancestry that is often associated, of course, with the Jewish population, it's so critical that we have deep representation on our registry so that when those patients come through with that same genetic background, that we are much more likely to match. So from a matching perspective, you are far more likely to match a patient who comes from that exact same genetic background. So if we have a patient like Zoe coming through with an Ashkenazi background, we are far more likely to find that match with a donor of that same genetic background. Now, it's a much smaller population. So when we talk about Western European ancestry, we have a lot of representation on our registry. So when a patient comes through with that very common genetic background, they may have a list of hundreds of donors to choose from, which is fantastic, right? So when that physician enters that patient search, they'll see hundreds of potential donors coming through. What's critical there is that if donor number one can't move forward, we can move on to donor number two, donor number three. What happens in a smaller population, so in the Ashkenazi Jewish population, those numbers are smaller they're smaller. And so on our registry, they're also smaller. So when we have a patient with that background, if they are fortunate enough to have donors that match, it is much more likely that list is smaller. And that's problematic, right? Because if that donor, for whatever reason, is unavailable, if that donor is pregnant and can't move on with donation at this moment in time, if they have, since they registered, they have their own new medical issues that they're not able to medically proceed with donation, there's not another donor to go to. And so that's another critical factor here is we need the representation on the registry so that physicians have the options and be able to choose the best option for their patient.
So let me ask you now, just to talk about what you've just said, you have to get the word out.
Yes.
In our case, in our community, we're a small community to begin with, somewhere around 6 million people. Most in our country are Ashkenazi, not all, and there is a large Sephardic population. But we're in a country of 330 million people.
Right.
How do you get the word out? How do you educate about this in order to bring folks in to get on that registry?
Yeah, it's a great question. And that's something that we as an organization continue to evolve and have evolved for the last 30 years, is trying to figure out the best ways to get into the specific communities so that we can continue to provide the right graft sources for our patients, right? So we've done a lot of different things in terms of marketing. How do we make sure that we are connecting with the right leaders to make sure that our voice can be heard? Another piece is that, getting it out into the right audience, but also the right audience and the right level of voice, right? There's a lot of noise out in the world. How do we get our message out there? How do we make it heard? And how do people actually take the action that we need them to take? That's something that we're constantly evaluating, that our marketing team is working with. And it comes down to, the way that we can market anything, any individual need that we have that's out there in the world. It's getting to the right people to help spread the word. So how do we get into the communities? Who are the community leaders? How do we engage with them? Make sure that they understand our mission and what it means for the community, right? And engage them, help them to understand what our needs are so they can help spread the word. That's the bottom line, right? Is making sure that we're connected at the community level to the right leaders, whether it's religious leaders, whether it's individual community leaders that can help spread that word, because the impact here, as I mentioned, is beyond that patient. The positive impact runs out to the full community of the impact of actually being able to donate and save somebody's life.
Do you find that that most people on the registry, or many people on the registry, are there because of a family member or a good friend who has leukemia or a related disease?
Yeah, people find their way to be the match through a lot of different avenues, but that is absolutely one of the key avenues that people find their way to be the match. Is somebody in their family, somebody in their community is out there saying, I need a match, or I am a patient. I went through Be the Match. I found my donor through Be the Match. And it's a way for people to really feel on a personal level, right? That's a way that, of course, a message is spread very easily, is to know somebody who is positively impacted or who needs that positive impact, to know that I have the ability on a personal level to impact another individual on a personal level. And so that's really, it's really key. And many donors find their way to us through those exact mechanisms. Others find it by the marketing that we are doing within individual communities, individual markets. It is important to us. You mentioned at the very beginning about Be the Match being the most diverse registry in the world. That's critically important to us. The number of donors is also really important because we need to have that broad representation, but the diversity on the registry is key so that we can serve all populations that need a donor coming through Be the Match.
Let's talk about the international aspect of this. There's a patient in Sweden, or there's a patient in Colombia.
Sure.
How does it work? They contact you? Is this something that you do all the time? Were you getting these inquiries from outside? Do you reach outside to others? How does it work?
Absolutely. So the international component is huge. Actually, 50% of our products have an international component, meaning either the patient is outside of the United States or the donor is outside of the United States. So when a physician is looking for a donor for their patient and they're outside of the United States, we have mechanisms that they can see the registry, they can see who the potential donors are and where they're located. And then we go through the process of evaluation with that particular donor to ensure that it's truly the right donor for that particular patient. So we are working with our international partners on a daily basis. Crossing borders is something that we do on a daily basis. Like I said, 50% of our products, and we managed 6,500 collections last year. Of those, 50% had an international component to it. We're moving bone marrow products around the world on a daily basis. So that's another important call out there, is that if we, with Ashkenazi Jewish patients in the United States, they can look for that match on the registry here in the United States. But if there is a match for them in Israel, we have partnerships in Israel. If there's a donor in Israel that is a match for that particular donor, that's just, it's all on a unified list for that physician to sort through. And wherever that donor is the best match for that patient, we will help to facilitate getting that product here to that patient, and vice versa for a patient outside of the United States.
What are some of the biggest hurdles, especially now in the age of COVID-19? Has that impacted your work in any way?
It has impacted our work greatly. It's really hard to find an organization that has not been impacted by COVID right now, and we are no exception to that. So I think first and foremost, one of the major impacts for us is that we are always looking to recruit donors, young, healthy donors. Where do you find young, healthy donors? College campuses. That's where we do a lot of our recruitment. Our live drives happen at college campuses. That was not an option for the last half of this year, right? So starting in the February timeframe, many colleges went remote. Most of them, sent students home for the year and did online learning. So we did not have the ability to do our live drives that we're accustomed to doing to really attract and educate that young donor population. The recruitment has been a major impact with COVID-19. We've always had, for the last many years, had an online presence for people to register online. We've of course pushed really hard on that platform right now during COVID without our ability to do those live drives. And the other piece is knowing that, that we have that 50% of our products have that international component. Product transport, a major issue. So you think about airlines. We use commercial airlines to move products. We have hand-carried couriers, so couriers that are accountable for moving the product from the point of collection to that patient. They're on commercial flights. We all know how commercial flights have been impacted by COVID-19. So the month of March and April are a blur, just as they were to many people in many different organizations. But we did what we had to, and we were able to move 100% of the products that we needed to with a whole lot of ingenuity and creativity. But we were able to do that. We did not have a single patient that was prepped for transplant that did not receive their product. So a whole lot of effort by my colleagues at Be the Match, as well as all of our network partners around the world to make that happen. Like I said, a whole lot of creativity. We were moving product from border A to border B to border C, rather than just taking that direct flight because of the challenges with COVID.
Well, we hope that improves. So that situation improves for all of us, but especially for those in the business of saving lives. Tell us about Zoe Smith, a patient receiving attention now. A colleague of mine and myself independently saw a picture of Zoe on one of the websites that we read, and which led to this program. Tell us about her and her story, and what can people do to help?
Absolutely. I'm happy to share Zoe's story. So Zoe is a toddler. She's 14 months old. And while on a family vacation, just started to experience some extreme symptoms of fatigue. And the family continued to bring her in for appointments, asking and saying, something's not right. Something's not right. They continued to follow their gut and their instinct to say, we need to dig deeper. Something is not right. And she was eventually diagnosed with leukemia. Zoe has a very her background, as we've mentioned, she has a background of Ashkenazi Jewish ancestry as well as English ancestry, and so finding the perfect match is challenging. And right now, we continue to look for that perfect match for Zoe. She does not have that perfect match. As I've mentioned, we are much more likely to find that with that ancestry of Ashkenazi Jewish background, and so we continue on a daily basis to look at options, to peruse our registry, to peruse the worldwide registries to find the right donor for Zoe. So what people can do is to join the registry, not only for Zoe, but for every searching patient that we have out there. So by joining the registry, you provide that hope to those patients that are searching, Zoe and 12,000 others that are looking for that perfect match every single year. So to do so, to join the registry, you can go to bethematch.org/Zoe. And what will happen is that you will answer a few questions about your medical history. And with that, we will trigger what we call a buccal swab kit that will be sent directly to your home. That buccal swab kit is a cheek swab kit. So it's purely, they look like Q-tips. You just swab the inside of your cheek. So different than what you may be used to through Ancestry, through those types of organizations. This is purely just a swab of your cheek. That is then sent back to our organization. We facilitate the typing of what we call the HLA, the human leukocyte antigen. That's the actual matching algorithm that we use to match donors and patients. We do that. We get those results back, and then you are officially listed on the registry for those physicians that are looking for a match for their patients, including Zoe.
Now, are you looking for a specific, for example, is it better for the donor to be from a certain age group? Are you too old to do this? Are you too young to do this? What are the guidelines for being a donor?
Absolutely. So to be an unrelated donor on the Be the Match registry, you need to be between the ages of 18 and 60. We know that our physicians tend to certainly, if all options are available, so if we have a search in which we do have the opportunity for multiple donors, if all other things are equal, if we have a 40-year-old donor and a 20-year-old donor, the physicians will proactively select that 20-year-old. The reason for that is simply because we tend to see, we see better outcomes, not tend to, we see better outcomes with those younger donors because of the stem cells that are coming from that younger population. So that's why we really tend to target recruitment of young college-age students, because by the time they register and by the time that somebody may need a match, we've already lost years there. Donors tend to sit on the registry for a couple of years before their patient comes along if they're called to be a donor. It's generally several years that they're on the registry. That's why we really target that young population, that physicians have that opportunity to have a young donor for their patient to provide better outcomes for that patient. So it's truly outcomes based. If that young donor isn't available, if that perfect match is a 35-year-old individual, that physician will absolutely proceed with that. But given the choice, they will take a younger donor.
And time is really of the essence here.
Absolutely.
Right? Well, Jamie, I can't think of any higher calling than to be in the service of saving lives. And that's what Be the Match does. That's what you do. It's really something that we should think more about. I think a lot of times we take these kinds of things for granted, particularly if it's not in someone's family. And it's important to know that you're out there and that you're doing what you do. The organization is Be the Match. You can learn more about their work and how you can help save lives by heading to the match.org website. Thank you, Jenny, for being with us today.
Thank you, Dan. I really appreciate it.
And thanks, everyone, for spending the time with us. We appreciate it. If you found this program to be of particular interest, make sure you never miss a show by subscribing to the B'nai B'rith YouTube channel. And be sure to visit our website, bnaibrith.org, to learn about our work. Like us on Facebook and follow us on Twitter. For my guest, Jamie Margolis, I'm Dan Mariaschin. Join us again next time on Conversations with B'nai B'rith.